Hello, I am Dr. Vishwas. I am a doctor of this clinic. I confirm that you are Mrs. Amanda Seyfried, 31 years.
Yes, doctor.
Okay. I am here to discuss about your health condition and our further management plan with you. Is that okay for you?
Yes, doctor. I'm eager to know about it.
Okay. Before I proceed, may I know that how do you feel now?
Doctor, I'm not feeling well, doctor. I have been having this tiredness all around for quite a long time now. And I have been on and off to the hospital. I have been run several tests, but I still don't know what's going on with me. But I don't feel well at all. So what's going on with me, doctor? What treatment would you start in treatment? And what's with me? What's going on?
I am extremely sorry for your condition. And before I give your answer, may I know that do you have any idea what is our diagnosis?
Doctor, actually, uh, I'm very disappointed that the doctor, the consultant actually told me that I have been diagnosed as having chronic fatigue syndrome or something like that, that it's not anything serious. And he just told me that some exercise would better me up. So I'm not satisfied with it, doctor. I have been so much tired and so much, life has been so much difficult. How can it be nothing, doctor?
I can understand your frustration. And will it be okay if I discuss this condition in details with you?
Yes, doctor, please.
Okay. And before I start discussing, may I know that what about your symptoms or what were causing bothering you, so that I can give you the best explanation.
Oh, doctor, I have been feeling tired all the time, quite all the time now, and I do also feel that I have some uh, ache in different parts of the body. So actually, and I can't go to my work as well. I have to skip. Had to skip several working hours, several days as well. So it's been a very difficult life for me, doctor.
I'm sorry to hear that. And to rule out all the causes of your symptoms, as you know that we have done several tests for that. And do you know that what was the test?
Doctor, I don't know specifically, doctor. I have just been told that there had been very many that almost all tests are done, but I don't know specifically about it.
Actually, for your symptoms, there could be some possibilities, and we have tried to rule out all those. For this, we have done your blood test, test of your neck gland, test of your chest, test of your lung, test of your heart, and test of your liver, kidney, and also
Mm.
your defense system. Do you get
Mm. Yes, doctor.
it? And it is luckily that all this test came normal. And please don't get frustrated that or don't want be bothered that all the test came normal. Then why you are having this symptom? It is actually a question that you also have raised.
Well, doctor, I'm just you are telling that all is normal. Then am I faking? What are you want trying to say? Am I faking it?
No, please don't misunderstand us. Actually, there are certain conditions where the test results can come normal. And at that time, we diagnose this condition by ruling out all other causes. We call it diagnosis of exclusion. Do you get me?
Well, I get it, doctor. Then why this is so severe? These symptoms.
As I have told you that there are certain conditions that can cause this type of symptom, and whatever the symptoms for diagnosis, we have done all the tests, and all the tests came normal. That kept us only one option left, and we are suspecting that diagnosis that our consultant also told you.
Well, doctor, you must think that I'm just depressed and I'm just telling about it because of depression. I think. Don't you think so, doctor? You're just thinking I'm depressed and so I'm making it up all by myself.
Please don't get so much frustrated by our decision. Actually, there are the diagnosis we made. It is certain and it is a truly existing disease condition, and we can understand that test results came normal, so that you became frustrated. Actually, as I have told you, that the diagnosis can be true, and a lot of people is also suffering from this condition, and we have dealt with this condition a lot of times. So we are not suspecting that you are having a condition in mind, you are having problem in mind, but actually this really exists, and we appreciate that, and we think that you are have this condition that our consultant told you, that chronic fatigue syndrome.
Okay, doctor. Well, you have done so many tests. I just cannot believe that it's all normal. Can you just do some more tests?
Actually, as I have told you, that we have tried find out all the causes, and this gave us and your symptoms, all your symptoms, and other physical examination test all came to the diagnosis of chronic fatigue syndrome. And at this stage, no other test will bring any benefit. Rather, it will increase your anxiety. Rather, it will increase the cost, and it will also put you some extra risk of having those tests. And our diagnosis is certain. So at this point, doing any other test is not necessary, or is not uh, will not bring any good.
Okay, that's all right. But can I have a second opinion, doctor?
Okay, you can always have a second opinion for that, and I can arrange that for you. And will it be okay if I discuss this condition of our diagnosis with you, so that you can get better idea?
Yes, doctor.
Yeah, as you have been told that your diagnosis is chronic fatigue syndrome. Actually, a lot of person suffer from this, and with this, actually, this is start following a bug infection. Sometimes we call it viral infection. Okay, so
Okay,
we are not suspecting that you are making this diagnosis, you are making these symptoms. We are suspecting that truly you are suffering from that.
okay,
And for this condition, we are extremely sorry to say you that there is no definitive cure, but there are certain good exercise and lifestyle management that can help you. And if you like, I can discuss that with you.
yes, doctor.
And with this symptom, it has been found that I am again sorry to tell you that we are not mixing up with your depression, but there are some other management that this condition can bring depression. So treating for depression, that can also improve this condition. And there are other certain treatment from the mood doctor that can help to improve this condition, and they are quite helpful. So if you want to know about this, I can discuss this with you.
Okay, doctor. Please discuss.
Okay, actually, there are certain treatment, we call it cognitive behavior therapy. Your mood doctor will be the best person to discuss in details with you with that. And we can arrange a meeting with mood doctor, so they can make an arrangement, and make an introduction with you, that what is it, and how it can help you.
Mm, okay,
Okay.
okay,
And also there are certain lifestyle changes, as I have mentioned, that some lifestyle changes like remain active. It has been found that if patient remain inactive for their symptoms, the condition get worsened. And for this remaining active, and there are certain exercise, I can talk with the exercise doctor, exercise specialist. They can advise you that what type of exercise will help you, and they really help with this condition.
okay, doctor. That's all right. But isn't there any medication, doctor?
As I have told you that this is not totally curable by any medication, but there are certain medication that can help you, and we can arrange a meeting with the mood doctor. They are in the best position to tell about the medication that will be helpful. That is medication include some that can uh, treat the depression, and some medication that also used to treat depression. They are sometimes quite helpful with this condition.
Okay, doctor. Okay.
Do you want to know anything else?
Well, doctor, I told you that actually I'm having some problem with my job
Yes,
due to tiredness, and so can you help me, doctor, in this
yes,
case?
I can understand that, and I also wanted to raise that issue. And for this, our hospital can talk uh, with your management system, and our occupational health therapist. They can also occupational health department. They can also make an arrangement at your workplace so that they can relocate your job, or they can find a suitable job that is manageable with your condition. If you like that, I can arrange for that.
Okay, doctor, and
You
that's all
made
right, doctor.
many. Okay. And in the meantime, will it be okay if I ask you a few personal question?
Yes, doctor, please, no problem.
Do you drink alcohol?
Within social limit, doctor.
Okay, that's good. Any binge drinking?
No, doctor.
That's fine. And do you smoke cigarette?
No, doctor.
Okay, that's good. And may I know that are you whom do you live with?
Doctor, I live with my husband.
And if you don't mind, may I know that is your is he supporting enough?
Yes, doctor, I think he has been quite supportive, doctor.
Okay, that is fine. And I can give you some leaflets, some website address so that you can get a better idea about your condition. Will it be okay?
Yes, doctor.
And if yeah, and at any time, if you have any question, then you can always contact us. Time up.
Okay, doctor. Okay, that's all right. Okay. So, what was your task?
Yeah, my task was to explain the disease condition named chronic fatigue syndrome.
Okay. So, do you think that you have done it well?
I think I have explained this, but I could have also tell it more about this, that the patients develop symptoms like muscle pain, and they are totally real. Sometimes the pain can be so severe, they can also develop weakness that can be so severe that they cannot go out of home. And we are aware of that, and we think that that is not a totally any psychological any problem with their depression, or that is not anything that they are making of symptoms. They are quite real. I could have mentioned this that specifically so that patient could get more confidence with that.
Yes,
we are we
yes,
are we are not suspecting that she is malingering.
yes. I think that was important. Hmm. Okay. Anything more?
uh, I cannot remember much.
Yes, I think you have done quite well. You have actually addressed most of the issues here, and I don't think so. Can you just tell me again for the audience actually that how to describe this chronic fatigue syndrome? How to open this up to the patient? This diagnosis.
Yeah, I am sorry to tell you that you have a we have made your case a diagnosis of chronic fatigue syndrome. Do you have any idea with that? Okay, may I explain this condition to you? Yeah, actually, in this condition, the cause is exactly not known that what happened, why this happened, but it is most in most person it is seen that after a bug infection, this comes. And this comes with symptoms like weakness, and that can be so severe that patient even sometimes cannot get out of their bed, and pain in their muscle, pain in their joints, and some lumps and bumps at at the neck, some swelling of the glands that can develop, and also they can develop low mood due to this condition. And also this condition, as it seems like they are making the symptoms, but and they are feigning, but actually these are the real symptoms, and patient may even develop this condition, but in this condition they all the test comes normal, as in your case. I am sorry for your condition.
Yes, yes. So then that was very helpful. And do anything. I don't personally want to add anything now. Do anyone want to add anything?
Yes, please. I want to ask one thing regarding referral to mood doctor. As far I know, it's not advisable to suggest any treatment unless it's mentioned in the task.
Oh,
So
Actually, I asked about the treatment.
it was given that she should be advised for regular exercise and cognitive behavioral therapy.
yeah, but the referral to mood doctor and starting medication for depression, it's not mentioned. And regarding the exercise, it's special type of exercise, graded exercise, not maybe by specialized physiotherapist. We should explain that it's a special type of exercise, not anyone can do it.
Okay. Yeah.
Yeah,
Yeah,
there are special exercises, and
That's very important point. This is a very important point. Yes. Okay. Anything more? Anything more?
No, thank you very much.
Okay, then I am stopping the session.
Okay.